As we mentioned, Dr. Kevin Kavanagh, Dr. K, he's the founder of Health Watch USA, he's a retired physician. Good morning to you, Doc.
Good morning, Jack.
How was your weekend?
It was very good. I have recovered from my illness last week and feeling very good this week.
Well, this morning we read that in Kentucky, 47% have received one dose and 39% fully vaccinated. That's still below the national average, though, right?
That's correct. And at one time, we were ahead of the national average. But the real problem with that figure is, in some areas of Kentucky, the vaccination rates are much higher, meaning that in other areas, it's much lower. And in those areas, they could be highly susceptible to one of these variants. And as we discussed last week, the Indian variant, the Brazilian variant, they're starting to take foothold in our nation and are starting to expand. And so I think we still need to get vaccinated, and that's the important message. If everybody would be vaccinated right now, I really believe, Jack, I'd be off the air and we'd be almost back to normal. So we really need to do this.
Why do you think people are still resisting it, or have they just not gotten around to it yet?
No, I think there's a real resistance. I think some of the leaders have created doubts in their minds regarding the efficacy of vaccination. I think that they're scared regarding some of the potential, although extremely rare, complications which could occur. And I mean, they're extremely rare compared to COVID-19. But one of the problems is a large percentage of our nation spent all last year hearing COVID-19 was no worse than the flu, which I have to say is a pretty dangerous infection. But also it's no worse than the cold. And so you combine those two things, you have a large number of people still not wanting to get vaccinated. You also have a resetting of, I think, our public health standards from where if you got diarrhea at a restaurant, people wanted to have that restaurant closed, to now, if you just live, it doesn't matter what condition you're in, everything's fine. And I just don't think that's correct. I think that we really do need to increase the public health standards that we're currently using for COVID, paying very much attention to long COVID and potential harm, which can occur even in the young.
You say everybody needs to get vaccinated. Are you also including children?
Well, down to the age of 12 right now. And as you know, Norton's Children's Research Institute, along with Pfizer, are going to be investigating vaccines down to the 6 months of age. So yes, children can spread the virus. And that's one of the misconceptions. They may not get ill nearly as much as an older adult, but they can still spread the virus. And there's a number of studies which have shown that, especially the older children above the age of 10. So we need to still be vigilant of that group and protect our children. And the best way to protect them is get those children vaccinated, because the group of children that's most likely to spread the virus is also the group that you can get vaccinated right now.
All right. Well, that's great information. And also, 3 Kentuckians 18 or older are going to become millionaires in the coming weeks, right?
Well, that's correct. And if you're between the ages of 12 and 17, you may actually get a free ride to a public school in Kentucky. 15 Kentuckians can fall into that category. So yes, you can do that, plus get a free Krispy Kreme donut. There's all sorts of pluses to get vaccinated besides not getting COVID-19. And believe me, Jack, millions, hundreds of millions of people have been vaccinated. They have been followed well over 6 months now. And the safety data coming in is extremely good. These vaccines are incredibly safe and incredibly effective, especially when you compare that to getting COVID-19.
Dr. Kevin Kavanagh, always a pleasure, sir. Thank you.
Thank you, Jack.
I'd like to win that $1 million, but boy, I tell you, that free donut sounds pretty good too, doesn't it? Yeah.
I signed up for the $1 million the other day.
Did you?
At shotatamillion.ky.gov.